The reference point to perform the single needle arthrocentesis of the temporomandibular joint can be easily found by drawing the so-called reference hormone line going from the mid-tragus to the lateral pole of the eye orbit. Normally, the entry point is about 1 centimeter in front of the tragus and a few millimeters below that If line. You put the index finger in front of the tragus and ask the patient to open the mouth, moving the condyle downward and forward, you can easily identify the glenoid fossa that has been left empty by the condyle that has moved. In such a way, you can contouring your finger and drawing a line that is more or less identifying the perimeter of the glenoid fossa. The entry point is in the middle. Concerning the anesthesia, we are here anesthetizing the area of the lateral pterygoid muscle insertion into the capsule of the TMJ. The successive step is the performance of the external anesthesia in the preauricular area. My favorite option is always to use anesthetic without adrenaline to limit the possibility that this kind of anesthesia influences the facial nerve. Then the intervention, you should ask the patient to open the mouth. The direction of insertion of the needle is forward and upward. You should be able to touch the inner part of the glenoid fossa, so the medial wall of the glenoid fossa. This is the safest way to perform a safe procedure, okay? In such a way you can be sure that if you get the needle a bit out from the original position, you are in. Then you can start positioning the saline solution. In many occasions, if you are properly into the joint capsule, you can notice that there is an immediate pumping effect. The needle moves, the mandible moves a bit, and you feel a sort of resistance, a sort of pressure when you try to push the fluid into the joint. Okay, look at the syringe that moves up and down, and the flow of the fluid out of the fossa when you ask the patient to move the mandible. The final step is the viscosupplementation, that is the positioning of the hyaluronic acid, normally medium or low molecular weight, into the glenoid fossa. The dose is 1 milliliter, and one of the advantages of the single needle technique is that you can position the hyaluronic acid without the risk that the medication gets out from the skin, from the hole of the second needle.